Welcome back to the Federal Executive Forum on Federal News Network. We're talking about healthcare IT and all things along that ecosystem. We're going to get into talking about a specific program. I want to start with you, Dr. Evans. A lot of stuff going on over there at VA. You talked about that at the beginning of the show. Give us an example of a specific program that you'd like to highlight for the community here.
Sure. We're still in the middle of the COVID-19 pandemic, so I would be remiss if I did not talk about our telehealth program in the VA.
Of course.
And how that has been really critical to our response to the pandemic. But frankly, a lot of that was based on a really strong foundation that VA had built over more than a decade in building a strong telehealth program, which was then able to expand very rapidly to address the sort of near immediate shift in location of care for many of our veterans. And just to give you a sense for the scale of the program, over the course of the pandemic, VA has provided more than 12.9 million telehealth visits. Last month alone, we supported more than 815,000 visits to 482,000 unique veterans in 1 month. I'll give you just a sort of another sense of that scale. Prior to the pandemic, we were doing on the order of 2,000 video visits, connecting veterans in their homes or preferred location to their VA healthcare providers on a typical business day. And we have seen numerous days with over 45,000 video visits occurring per day.
Wow.
Per business day. So this has really transformed really the options for veterans to access their care. This is really part of, when you get down to it, right, when we talk about health information technologies, to me, the real advantage of health information technologies are the connections that they enable. These technologies allow us to connect the veterans who are looking for their health care with their providers. They allow us to connect providers with each other because healthcare is ultimately a team effort. And so I think that has been really one of our most important lessons during the pandemic, is not just shifting care to veterans in the home where they needed to receive that care, but also leveraging our information technologies to better connect our healthcare teams when they sometimes were no longer co-located in the same place. They may have been seeing patients from home. They may have actually been in the clinic, but for reasons of trying to manage COVID risk, we're staying in separate rooms apart from each other and using technology to make the connections that might have in the past been made in person. So a lot of opportunity, and what's exciting to me is the opportunity that the healthcare system writ large has now. And this is not a unique story to VA. This has occurred across the Department of Defense, across private sector healthcare, and thinking about what the new normal of healthcare will look like, to me, is quite exciting.
I was just thinking that very thing. The fact that you've opened up this capability now, and the richness of that, and the ability to get an electronic record, remotely, et cetera, all those things connected together, just absolutely fascinating. Mobeen, how about at ServiceNow? Give us an example of one program you'd like to highlight that you all are working on to help this community.
Sure, I'll mention a couple. I'll start off with one that immediately comes to mind, which is some work that we did with Centers for Medicare and Medicaid Services, CMS. And so we did some work, started early this year, within 3 months. And the focus of this work was really about modernizing the employee experience within the organization. So we worked with them to design an employee portal called CMS Connect. It's powered by ServiceNow. And the employee portal is really a one-stop shop for the agency. It's front and center. It is facilitating a number of things like employee return back to work. It takes advantage of a number of core features within the platform. So, just being able to enable conversational services. I know there was some discussion earlier about things like machine learning and natural language understanding, and so it takes advantage of all of that. a knowledge base. So if users need to find information, request-based workflows, searching for information, even dashboarding and analytics, it's been a really critical and pivotal piece of the overall modernized employee experience within the agency. Another program I'll mention quickly also within CMS was just being able to help them when the pandemic kicked off with the 1135 waiver program. And so you think about just the 1135 waivers in general and the way in which they allow beneficiaries and providers to waive various administrative requirements to increase access to medical services during national emergencies. That was obviously a really big thing during COVID. And so being able to facilitate that reimbursement during the emergency, even if providers were unable to comply with certain requirements that would be required under normal circumstances, we were able to provide an interface that those providers and others could use to submit those waiver claims and to help broker and shepherd and orchestrate that entire process end to end. So just a couple of stories there that come to mind.
Sure, critical capability at a critical time. Ryan, you top-lined a lot of stuff that's going on there across the ecosystem, and I see all this fantastic outreach. Give us an example of one program that you'd like to highlight that you all are working on to further the cause in the ecosystem.
Yeah, happy to. I failed to mention earlier our work on health equity by design, and that's tied very closely to the US CDI and the introduction just in this last version of the inclusion of social determinants of health data, SDOH and SOGI data that helps to reduce healthcare inequities, and that ultimately we've seen result in health disparities. And this, I think, is based on not just what we've seen throughout the provider community, but also, again, with feedback from our federal partners, the firm and the VA among them. And one pilot program that we're really proud of is called the Leading Edge Acceleration Project, or LEAP. And we started that work a couple years ago, but this year's program is really exciting. It's based out of UT Austin. And as Ben mentioned, we are big proponents of fast healthcare interoperability resources, or FHIR based approaches. And these are more advanced than some can adopt, right now across the continuum, but in the pockets where that's working and where there are private sector partners that understand how to navigate the tools, it's really a powerful way to advance the exchange of information in not only clinical context, but also non-traditional healthcare environments. So health and human services at the state level, community-based organizations, federally qualified health centers. We hope this will be pervasive throughout the country, but this pilot is going to really help to pilot the referral management tools that are based on an accelerator out of HL7, Health Level 7 International, that we work really closely with. That is one way that we support semantic interoperability, again, that others have talked about. But we want to, and we really feel confident that this is going to help enable health IT for everyone, and to help with treatment, transitions of care, and referrals, so that the patient can take their information with them, and providers on both sides can get access to the information they need in a seamless, really non-obtrusive, and privacy protected, also is important to mention, fashion, closed loop, truly closed loop, and again, all tied back to the baseline SDOH data that's all collected in a standardized kind of clean format. So that's one example we're really excited about. And another one I'll just mention is our partnerships with NIH and CDC and the US Digital Service to help, again, deploy FHIR-based solutions for public-private partnership purposes in the pandemic. And two examples, we probably don't have time to get into it today, to your point about needing a full day, but making the data from at-home COVID testing more readily available, and also making sure that patients and everyday people across the country can find out how to get whether it's vaccine information or whatever information they need at their fingertips.
I love the idea of the non-traditional community, the state, local, tribal, et cetera. What a fantastic outreach. Appreciate everything you're doing. Nick, Ryan referred to all this information and certainly securing it. You touched on that. Give us an example of a program you'd like to highlight that you're furthering the cause here in this community.
Well, thanks, Luke. We've been very proud to partner for a number of years now with the Veterans Administration and more recently with Defense Health Agency. So the criticality of making data available, protecting it, increasing the velocity of those systems to provide better patient outcomes, to provide more efficient management of the agency's operations is really fundamental. But one of the things you don't hear anybody talk about is the criticality of IT systems management. And that's not anybody's core focus. So that's actually another thing that we've primarily focused on over, since our founding, is how do we make IT work for people, not people work for IT. So helping agencies modernize their infrastructure to create a modern data experience instead of a modern systems experience. And to make that all seamless enables people to focus on doing their work and serving their customer base, serving the communities that they are established to deliver services for: veterans, military, dependents. And the other thing that we focus on is data mobility and availability. Holly and I were chatting on the back channel. The Department of Defense probably has the most mobile workforce on the planet. So how do we help the data move to where the community moves, every individual service member? And they go places where there is no service infrastructure. So how do we help support healthcare operations forward in the battlefield? How do we help support dependent healthcare at home? And how do we help move that data from Europe to the continental United States to far-flung reaches of the Pacific? Those are all the things that we focus on. And we've been tremendously proud to help support the agency's efforts to support that data mobility, portability, and availability worldwide. And it'll continue to be core to what we do. And what we do in the government healthcare space is mirrored by what we do in the civilian healthcare space as well. So some of the largest patient record management platforms in the world are built on Pure Storage, not just in the United States, but also in Europe, in Germany, in Asia. So this is a critical area. Data is the fundamental component in patient management and healthcare and in research today. And it's our job to make sure that it's available, it's fast, it's accessible, and it's protected. And we're going to continue doing that.
And it's planetary and can run on an industrial scale. Holly, how about over at Defense Healthcare? Give us an example of a program you'd like to highlight.
Well, when I started out talking about our electronic health record and really that being the foundation, but it's really about how we're using that data. And so I'd like to highlight a couple areas where we're really pushing that data-centric model. I really liked what Nick said about the modern data experience versus a modern system experience, like shifting from that system focus to that data-centric model. And so we've looked at it from a registry perspective. For instance, when the pandemic kicked off, we had, when our response, we're looking at how can we use the registry information we have to really start to track this long term. So our EADS team created this pandemic registry where we're able to track and pull in all the data that's happening in disparate places for lab testing and now vaccinations. And we'll be able to create that sort of longitudinal research and look at the COVID information. All of the work we've done in the platform space to the point of being able to say, making it work for you. We did all this background work leading up to, being able to have that cloud environment, being able to get things to where it needs to be, enabled us to actually be able to provide that data, to provide the data to the CDC when needed, to provide it to the states, to provide where we were in this in this response, this massive response where we had to have data really at our fingertips, right? It's sounds easy to say, oh, connect it all together, right? But we all know working in this industry, it's a lot harder to do than it is to say. And so really,
we're talking about here.
Yeah. So, it's getting that in the hands of the people that need it. And so from COVID registry information to, I'll just give an example of opioid registries, for instance, being able to put that information right in the hands of a provider without them having to go look at a bunch of different systems. So you're able to connect that information in the back end and have it show up and say, hey, this is, a pharmacist can get an alert after, the system can scan, 285 data points and say, hey, this person is at risk for an opioid overdose. You may want to prescribe the drug to ensure that they do not overdose, or that needs to be tracked. Same thing for any kind of monitoring and looking at behavioral health. I mean, all of these things are about trying to take all these disparate pieces of information that we collect. I'll quote Colonel Catalina at our at the Defense Health Agency Health Informatics Office. He talks about, we're not data blind, we're in a data blizzard. Like, we can't see, we've got to figure out how to parse all of that information and get it into meaningful ways. And so I just, it's not a single program. It is a lot of things that we are doing on a daily basis to connect that information beyond just, oh, here's an electronic health record. It's how do we use that information to improve care? And I wanted, before I moved on, I wanted to highlight one other thing too, with Dr. Evans talking a lot about connected care. I wanted to give a shout out to the VA on this. As a result of all the hard work that they have done over the years in building that foundation for connected care, the Department of Defense was able to leverage their Video Connect processes, their actual code, things that they have done to really build that video telehealth capability. We were able to leverage that during the pandemic, and we've launched enterprise-wide Video Connect capability as well, based on what the VA has done. So it's been a really fabulous partnership working through the firm and also with Dr. Evans over in the VA.
Fantastic. Love the reuse there. Ben, how about at Red Hat? You brought up a couple of interesting examples on your last round here. Give us one specific program you'd like to highlight.
I'm going to step outside of federal for a second.
Sure.
There's some similar activities like this happening within the federal government with some of our customers, but I'm not allowed to talk about them yet. So this is a bit of a facsimile. So
Ben, you're on a radio show. Go ahead.
No, HCA Healthcare, okay, is very large integrated healthcare system. They used Red Hat open source software to create a scalable container-based machine learning platform focused to collect and analyze clinical data and signal caregivers in real time to initiate early sepsis care. The group also used automation management, analytics, and to support the real-time data collection, analysis, and proactively create notifications. But at the end of this, they're able to detect and identify sepsis up to 20 hours earlier than traditional screening methods, which is directly saving lives in the thousands and thousands and thousands. In addition, HCA Healthcare used this new technology capabilities to establish a health system that is decreasing the risk and cost of innovation. So they're rolling out new algorithms on the same platform and taking advantage of real-time data streaming and then real-time inference from that streaming data. And it's actually directly affecting quality of care. And they figured out how to inject the AI into an actual clinical operation. And that's what I had talked about earlier. That's really where I see the technology, the emerging technologies that we all hear so much about actually get used and actually make a difference.
Yeah, layering that that comprehensive new technology capability on top of all this data that's now available. Fascinating. We're going to have to keep it right there, and we're going to take a short break. You're listening to the Federal Executive Forum on Federal News Network.